So, today we're talking about peristomal hernias. Hernias being a defect in the fascia, in this case, the abdominal wall fascia, that allows the intestine to bulge through. Fascia, you might have seen it if you've prepared meat at home, is that strong, shiny, connective layer of tissue that can be found around bones, muscles, nerves, and many other body structures. Peristomal hernias are an incredibly common complication of getting a stoma, and knowing how stomas are surgically created makes this make sense. Using the anatomy apron, you can see how the intestine is cut, brought through the abdominal wall, and cuffed. Hernias are prone to developing where there are natural breaks in the abdominal wall. Commonly, they develop in the inguinal ring that leads to the inguinal canal in the groin, the umbilicus or the belly button, and in the esophageal hiatus, an opening in the diaphragm through which the esophagus and the vagus nerve pass. Hernias also commonly develop at previous surgical sites. There are a number of factors that increase your risk of developing a hernia. These include collagen disorders, heavy lifting, chronic coughing, as is seen with some lung diseases, obesity, malnutrition, post-operative sepsis, being of advanced age, routinely straining to use the bathroom, whether that's defecation or urination, steroid use, and ascites, which is a collection of fluid in the abdomen. Obesity as a contributing factor is not to be underestimated. Folks whose waistlines measure above 100 centimeters or about 39 inches have about a 75% chance of developing a hernia over their lifetime with a stoma. Other contributing factors to the development of a peristomal hernia include if the stoma was placed at the site of a previous surgical incision, as there's existing weakness, if the stoma was placed outside of the rectus muscle, and if too large of an opening was made in that abdominal fascia during creation of the stoma.